Hello, let's talk about heart health and methods of maintaining it using folk remedies. Cardiovascular diseases are one of the leading causes of death worldwide. This includes atherosclerosis, hypertension, myocardial infarction and other heart-related problems. Heart disease is often caused by poor lifestyle habits including poor diet, physical inactivity, stress, and lack of sleep. However, folk remedies can help maintain a healthy heart. All you need to know about heart disease. Heart disease refers to any problem that affects the heart, such as coronary artery disease, arrhythmia and heart failure. According to the Centers for Disease Control and Prevention, CDC, heart disease is the leading cause of death in the United States. Around 1 in 4 deaths. Trusted source. Trusted source. Centers for Disease Control and Prevention, CDC. Government agency. Go to source. Heart disease is the leading cause of death in the United States, and it affects all genders and all racial and ethnic groups. In this article, you will learn about the types, causes, and symptoms of heart disease. This article also covers risk factors and treatment. Types. Heart disease is any condition that affects the cardiovascular system. There are several different types of heart disease and they affect the heart and blood vessels in different ways. The following sections look at some of the different types of heart disease in more detail. Coronary artery disease. Coronary artery disease, also known as coronary heart disease, is the most common type of heart disease. It occurs when the arteries that supply blood to the heart become clogged with plaque. This causes them to harden and narrow. Plaque contains cholesterol and other substances. As a result, the blood supply is reduced and the heart receives less oxygen and fewer nutrients. Over time, the heart muscle weakens and there is a risk of heart failure and arrhythmias. When plaque builds up in the arteries, it is called atherosclerosis. Plaque in the arteries can cause blockages and rupture, stopping blood flow and leading to a heart attack. Congenital heart defects. A person with a congenital heart defect is born with a heart problem. There are many types of congenital heart defect, including atypical heart valves. The valves may not open properly, or they may leak blood. Septal defects. There is a hole in the wall between either the lower or upper chambers of the heart. Atresia, one of the heart valves is missing. Congenital heart disease can involve major structural problems, such as the absence of a ventricle or problems with unusual connections between the main arteries leaving the heart. Many congenital heart defects do not cause any noticeable symptoms and are only discovered during a routine checkup. According to the American Heart Association, AHA, trusted source, heart murmurs are common in children, but only some are due to a defect. Arrhythmia. An arrhythmia is an irregular heartbeat. It occurs when the electrical impulses that coordinate the heartbeat do not work properly. As a result, the heart may beat too fast, too slow or irregularly. There are several types of arrhythmia, including tachycardia, this is a fast heartbeat. Bradycardia, this is a slow heartbeat. Premature contractions, this refers to a premature heartbeat. Atrial fibrillation, this is a type of irregular heartbeat. A person may feel a fluttering or racing sensation. In some cases, arrhythmias can be life-threatening or cause serious complications. Dilated cardiomyopathy. Dilated cardiomyopathy is a condition in which the heart chambers become dilated, meaning that the heart muscle stretches and becomes thinner. The most common causes of dilated cardiomyopathy are previous heart attacks, arrhythmias and toxins, but genetics can also play a role. As a result, the heart becomes weaker and cannot pump blood properly. This can lead to irregular heartbeats, blood clots in the heart and heart failure. It usually affects people between the ages of 20 and 60, according to the AHA. Myocardial infarction. A myocardial infarction, also known as a heart attack, is when blood flow to the heart is interrupted. This can damage or destroy part of the heart muscle. The most common cause of a heart attack is plaque, a blood clot or both in a coronary artery. It can also happen when an artery suddenly narrows or spasms. Heart failure. When a person has heart failure, their heart is still working, but not as well as it should. Congestive heart failure is a type of heart failure that can result from problems with the pumping or relaxing function of the heart. Heart failure can result from untreated coronary artery disease, high blood pressure, arrhythmias and other conditions. These conditions can affect the heart's ability to pump or relax properly. Heart failure can be life-threatening, but early treatment of heart conditions can help prevent complications. Hypertrophic cardiomyopathy. This condition usually develops when a genetic problem affects the heart muscle. It is usually an inherited condition. The walls of the muscle thicken and contractions become harder. This affects the heart's ability to take in and pump out blood. In some cases, it can lead to a blockage. There may be no symptoms and many people are never diagnosed. However, hypertrophic cardiomyopathy can get worse over time and lead to various heart problems. Anyone with a family history of the condition should be screened, as treatment can help prevent complications. Hypertrophic cardiomyopathy is the leading cause of cardiac death in young people and athletes under 35, according to the AHA. Mitral valve regurgitation. This occurs when the mitral valve in the heart does not close tightly enough and allows blood to flow backwards into the heart. As a result, blood cannot move efficiently around the heart or body and can put pressure on the heart chambers. Over time, the heart can become enlarged and heart failure can develop. Mitral valve prolapse. This happens when the leaflets of the mitral valve do not close properly. Instead, they protrude into the left atrium. This can cause a heart murmur. Mitral valve prolapse is not usually life-threatening, but some people may need treatment for it. Genetic factors and connective tissue problems can cause this condition, which affects around 2% of the population. Aortic stenosis. In aortic stenosis, the pulmonary valve is thick or fused together and does not open properly. This makes it difficult for the heart to pump blood from the left ventricle to the aorta trusted source. A person may be born with this condition due to congenital abnormalities of the valve, or it may develop over time due to calcium deposits or scarring. Symptoms. The symptoms of heart disease depend on the type of heart disease a person has. Some heart conditions may not cause any symptoms at all. However, the following symptoms may indicate a heart problem: angina or chest pain, difficulty breathing, tiredness and lightheadedness, swelling due to fluid retention, or edema. In children, symptoms of a congenital heart defect may include cyanosis, or a blue color to the skin, and an inability to exercise. Some signs and symptoms that may indicate a heart attack include chest pain, shortness of breath, palpitations, nausea, stomach pain, sweating, pain in the arms, jaw, back or legs, feeling of suffocation, swollen ankles, tiredness, an irregular heartbeat. A heart attack can lead to cardiac arrest, when the heart stops and the body stops functioning. A person needs immediate medical attention if they have symptoms of a heart attack. If cardiac arrest occurs, the person needs immediate medical help. Call 911. Immediate cardiopulmonary resuscitation. A shock from an automated external defibrillator, if available. Causes and risk factors. Heart disease develops when there is damage to all or part of the heart, a problem with the blood vessels leading to or from the heart, a low supply of oxygen and nutrients to the heart, a problem with the heart's rhythm. In some cases, there is a genetic cause. But some lifestyle factors and medical conditions can also increase your risk. These include high blood pressure, high cholesterol, smoking, high alcohol intake, overweight and obesity, diabetes, family history of heart disease, dietary choices. Age. History of preeclampsia during pregnancy. Low activity levels. Sleep apnea. High levels of stress and anxiety. Leaky heart valves. The World Health Organization, WHO, trusted source identifies poverty and stress as two key factors contributing to the global increase in heart and cardiovascular disease. Treatments. Treatment options vary depending on the type of heart disease a person has, but some common strategies include lifestyle changes, medication and surgery. The following sections look at some of these options in more detail. Medications. A variety of medications can help treat heart disease. The main options include anticoagulants, also known as blood thinners. These medications can prevent blood clots from forming. They include warfarin, Coumadin, and the direct oral anticoagulants dabigatran, rivaroxaban and apixaban. Antiplatelet therapies. These include aspirin and can also prevent blood clots. Angiotensin-converting enzyme inhibitors. These can help treat heart failure and high blood pressure by widening blood vessels. Lisinopril is an example. Angiotensin II receptor blockers. These can also control blood pressure. Losartan is an example. Angiotensin receptor neprilysin inhibitors. These can help reduce the workload on the heart and interrupt the chemical pathways that weaken it. Beta blockers, metoprolol and other drugs in this class can reduce heart rate and blood pressure. They can also treat irregular heartbeats and angina. Calcium channel blockers. These can lower blood pressure and prevent arrhythmias by reducing the pumping force of the heart and relaxing the blood vessels. An example is diltiazem, cardizem. Cholesterol-lowering drugs, statins, such as atorvastatin, Lipitor, and other types of drugs can help reduce the amount of low-density lipoprotein cholesterol in the body. Digitalis, medicines such as digoxin, Lanoxin, can increase the strength of the heart's pumping action. They may also help treat heart failure and irregular heartbeat. Diuretics. These medicines can reduce the workload on the heart, lower blood pressure and remove excess water from the body. An example is furosemide, Lasix. Vasodilators. These are medicines that lower blood pressure. They work by relaxing the blood vessels. Nitroglycerin, Nitrostat, is an example. These medicines can also help relieve chest pain. You can read more about vasodilation here. A doctor will work with you to find the right option. Sometimes there are side effects. If this is the case, the medication regimen may need to be reviewed. Surgery. Heart surgery can help to treat blockages and heart problems when medication is not effective. Some common types of surgery include coronary artery bypass surgery. This allows blood flow to reach a part of the heart when an artery is blocked. Coronary artery bypass grafting is the most common type of surgery. A surgeon can use a healthy blood vessel from another part of the body to repair a blocked vessel. Coronary angiography. This is a procedure to widen narrowed or blocked coronary arteries. It is often combined with the insertion of a stent, a wire mesh tube that allows blood to flow more easily. Valve replacement or repair. A surgeon can replace or repair a valve that is not working properly. Repair surgery. A surgeon may repair congenital heart defects, aneurysms and other problems. Device implantation. Pacemakers, balloon catheters and other devices can help regulate the heartbeat and support blood flow. Laser treatment. Transmyocardial laser revascularization may help treat angina. Maze surgery. A surgeon can create new pathways for electrical signals. This may help treat atrial fibrillation. Prevention tips. Some lifestyle changes can help reduce the risk of heart disease. These include eating a balanced diet. Choose a heart-healthy diet that is high in fiber and includes whole grains and fresh fruits and vegetables. The Mediterranean diet and the DASH diet may be good for heart health. Limiting your intake of processed foods and added fat, salt and sugar can also help. Exercise regularly. This can help strengthen the heart and circulatory system, lower cholesterol and maintain blood pressure. A person may aim for 150 minutes of exercise per week. Maintain a moderate body weight. A healthy body mass index, BMI, is usually between 20 and 25. People can check their BMI here. Quit or avoid smoking. Smoking is a major risk factor for heart and cardiovascular disease. Limit alcohol intake. Women should have no more than 1 standard drink per day and men no more than 2 standard drinks per day. Treat underlying conditions. Seek treatment for conditions that affect heart health, such as high blood pressure, obesity and diabetes. These steps can help improve overall health and reduce the risk of heart disease and its complications. The outlook. Heart disease is a common health problem. There are different types of heart disease. Some are caused by genetic problems and cannot be prevented. In many cases, however, a person can take steps to prevent heart disease and its complications. These steps include eating a healthy diet, getting plenty of exercise and seeking advice if you have any symptoms of heart disease.